Welcome to another edition of the Invisible Wheelchair Interview Podcast. I'm Donald Grodoff, family coach with FamilyOCD.com, FocusedHealthyFamily.com, and of course, InvisibleWheelchair.com. In the Invisible Wheelchair interviews, I get the wonderful chance to interview some of the experts with obsessive-compulsive disorders, professionals that treat OCD, people who are going through or have been through OCD, parents and caregivers of those suffering from OCD, and of course anyone that advocates for treatment of OCD. My goal of these interviews is to inform people on all aspects of OCD and bring about awareness of obsessive-compulsive disorder. The content, information, resources, and ideas that are talked about and brought up here in these interviews are not necessarily the views and opinions of myself, Family OCD, Focused Healthy Family, and Invisible Wheelchair Podcast, and I always recommend to seek additional professional help in finding solutions for yourself. You can find out more about me at FamilyOCD.com, FocusedHealthyFamily.com, and InvisibleWheelchair.com. I am so happy today to introduce you to Debby Houston. Debby Houston is a licensed independent mental health practitioner. She has worked at the Bryan Medical Center in Lincoln, Nebraska in acute psychiatric care for 30 years. She has also worked in private practice for 25 years. She has extensive experience working with clients with obsessive-compulsive disorder. Debby lives in Lincoln, Nebraska with her husband of 46 years. She received a BA from the University of Kentucky in 1973 and a Master's of Science degree from the University of Nebraska in 1990. She is also the author of Mervous Tames OCD, a wonderful children's book that helps them understand OCD and be able to find ways to get through it. Let's get to the interview now. So Debby, I really appreciate you being here on the Invisible Wheelchair Podcast today. Thank you for being part of this.
Thank you.
So Debby, what I like to do with anybody I interview is I like my audience to kind of get a personal feel of them. So maybe if you had a story you want to tell or something about yourself that you'd like to share with my audience.
Okay. So let me start by saying OCD comes unexpectedly for the most part. And it generally comes to families who don't know anything about it, and they have fallen into a pit and they have no idea what just happened. So I'll share my original pit with you. A number of years ago, before I went to graduate school, or no, I guess I had already gone to graduate school, but there's no training per se in grad school for the particulars of the disorders that you run into. I have 3 children. They were all at home at that point in time. I happened to have been home one day from work with a child who was ill, and I was watching something like a Jerry Springer show or something like that. And I was observing this man talking about being compelled to straighten the fringe on a rug on the floor. And he said, I just couldn't stop straightening the fringe, and I never got it right, and I just couldn't do it. I was intrigued by that because I believe I was a young therapist at the time. I received my master's degree in 1990, and this might have been right after that or something like that. And I was intrigued, and I thought, what in the world are they talking about? Lo and behold, not very long after that, and of course he talked about OCD, and he referred us, by the way, in that program to a book by Dr. Jeffrey Schwartz called Brain Lock, which I purchased and read because I thought it was very interesting. I've used with all of my clients, by the way, in addition to my own. Not very long after that, one of my children, who was in high school at the time, began to come to us with some issues, what I later found out were scrupulosity. Began to say things like, I think I hurt Dad's feelings, but I'm not quite sure. And I think I told him I'm sorry, but I'm not sure if I did. Do you think I did? I would say, well, of course you did. I was standing right here when you said X, Y, Z. But I'm not sure if I did. I don't remember if I did or not. And there was just no amount of reassurance that could solve this. Then I began to think back to several years before I had gone to grad school. I just was an at-home mom with 3 kids. I was at home for 15 years before I went to graduate school with my children, very close to them, very connected to them. You know, everyone has their own unique personality, but this particular child was a little more sensitive than the others. And in the 3rd grade, I noticed he started to do some peculiar things with his fingers. He would move them around, and I can't demonstrate to you, just sort of count his fingers over and over again. And he was very anxious. And I said, stop that Mervous behavior. And that's all I knew how to do, right? Stop this behavior. And because it was irritating and it looked weird, quite frankly, I realized that he had a very high-strung teacher. And so I thought it was a teacher problem. So I went to school. She was just all over his case. He does this wrong and he does that wrong. You know, he's a very, very intelligent kid, like very intelligent kid, which a lot of people with OCD, by the way, are very intelligent because it's a complex kind of way that they figure out how to manage it. But anyway, so I sort of yelled at the teacher and I said, I don't want him to have any more homework. I realized that he was getting more and more anxious about his homework. And in fact, right around that same time, it was a Sunday afternoon, and I went up to his room and he was laying in the top of his bunk bed crying. And I said, what is the matter? And he said, I can't cross my T's. And I said, what are you talking about? And he got down into the bunk and he showed me his homework, and he'd erased and erased and erased his T's off the paper, and he couldn't get them right. And that prompted me, along with the weird finger movements, to go and sort of yell at the teacher, no more homework for him. And it was like May anyway, because she was on his case to get it right. And that was my original intro into OCD. And then fast forward into the high school thing, he got a little better because summer came and things were better. You know, he had some perfection issues, but I just figured he's a smart kid and he wanted to get it right. And then we fast forward into high school, when there was this time of scrupulosity, of a moral doubt. I think I did something terrible and I don't know what it was. So that's kind of my personal story. Oh, I also did give him then a reference to the Brain Lock book. He read it. He used the 4-part strategy in the back, and it really did help resolve that acute phase for him. That's my original initiation, not knowing at first what we're dealing with, and then it goes away like it does sometimes. And then it comes back unexpectedly. And so then I began to be intrigued and study and work with clients and that sort of thing. So that was how I got into working with OCD.
Well, thank you. It's a wonderful story, and I can relate a lot to it since my own children are going through. I don't know if I'd say similar. They had different issues, but I know the OCD factor, so I can relate. You presently are a therapist that work with people with OCD, so maybe you could tell us a little bit about your practice and what you do in helping clients to get past it. And I don't like to say cure, because I don't believe you really cure it. I think you just get them to a manageable place with it. So what do you do in your practice to?
Well, the fortunate thing is that I actually have 2 jobs. I've worked in acute care psychiatric for almost 30 years this May. You tend to get people that are more severe in an acute setting. So it's been a fabulous training ground for me in normal therapy settings and outpatient therapy, which I also have done for a number of years. I think maybe 26 or 27 years now. You tend to get people who are healthier. The combination of those 2 things have worked really well for me. In the acute care setting, I have worked with a number of people with OCD, but you don't get to work with them very long. You just get that presenting crisis. And so often people will come in and the first thing they say is, I think I'm crazy, or I think I've done something terrible, or I'm going to do something terrible. So I'm going to speak first to the acute care setting. Of course, I won't identify any patients or in any way. In terms of practice, the thing that I find is that education is one of the most important things that we do with people. It's almost curative in the sense that when a patient gets that first, aha, that's what it is, there's such a relief that they know that they're not losing their mind, they are going to be okay, and they're not going to act on those things that they're afraid of for the most part. Okay. Once you start to explain that this is a brain problem, and you begin to explain that there are 9 different ways that OCD can manifest, then you start to explain to them that I'm going to refer them to a therapist that, and by the way, I can't take them from the hospital, so I have to refer them to other people because that's a conflict of interest. I have a few select people that I work with, and I explain to them what's going on in their brain, and then I start to say, as soon as we give you some tools to help you gain mastery, because mastery is the key, learning how to master this instead of it mastering you, there's such a relief that comes, and people do begin to get a place to put it. So that's in the acute care setting, and I do that. I see people like 2 or 3 days, or maybe 4 or 5, depending on how severe it is. But honestly, I mean, I've had actually clients who've committed suicide over OCD being so terrible. I've lost several patients that because of OCD. It's just terrible. Remember, it always comes in 3 flavors: mild, moderate, and severe. And when people begin with the mild to moderate phase, it's the most beneficial to engage in therapy at that point. When it's severe, you have to do so much ground laying and, framework presenting and that sort of thing, because they're so anxious they can't hear anything you say. Once in a while, I'll get people in the acute setting at that level, and that's very concerning. And, I do some mindfulness exercises. I do some staying in the moment, under education, giving them some tools and sort of setting up the framework. But now in my practice, that's where it really gets fun. What I do is I just have such a passion for working with people. So and I'm an extrovert, so I never get tired. So I basically go work at the hospital from 7:30 to 4 in the afternoon. Then I see clients from 4:30, 5:30, 6:30. I used to see 4 a night, but that got to be a bit much because I'm not a spring chicken. So I see 2 to 3 now. Not everybody in my practice has OCD. I work a lot with just anxious people because it is an anxiety disorder. It's on the spectrum of anxiety disorders. So we approach anxiety disorders very similarly. To go on in my practice, again, I start with education because often people will come in, a parent will bring a child, although they don't work so much with children anymore, but they'll bring a child or just themselves, and they'll say, I think, it's usually almost always, I think I'm crazy. We start with, well, it does feel crazy, of course, because it's sort of out of the norm. I'll start explaining what OCD is, how it works in the brain, that it's a brain disorder, and that we're going to do some things to help you get better. And you are going to get better with therapy because we're going to work there and we're going to work on it till you get better. And that relief usually is just powerful, to know that because somebody knows what's going on. If you go to a therapist that doesn't understand OCD, you are wasting your money.
Yeah.
Because, you can't, the first thing I tell people is you have to learn not to trust your feelings. Most therapy says, how do you feel about that? How do you feel about that? And in OCD therapy, I say, I don't care how you feel. It makes no difference to me. We're going to teach you how to think, because your feelings and your thoughts will not line up. And we have to learn to discard your feelings. I'll give you an example of something that of course, my patients have taught me the most. They teach me everything, right? As I was beginning in the early process of learning what OCD was, et cetera, in my outpatient practice, I had a patient that came to me, and it took her forever to get to my office. She was always on time, but she left about 2 hours early. She didn't live very far away. And her particular scenario was every time she would hit like a bump in the road, like a stick or something that the car jarred, she would get out, go around behind it when she was sure she had run over someone, and she would be hysterical. And she would say, I know I did. They've gotten up, they've run away. And sort of the OCD brain gives you all the rationale for why it's still true. You're crazy, and it's a matter of time till she's caught and arrested. And by the time she would get to my office, she would be hysterical. They're going to come and they're going to find me, and I'm going to be arrested. I know I hit somebody. And finally, I looked at her one day and I called her by name and I said, you know what? You can't trust those feelings. Your feelings don't matter whatsoever. But I feel like I hit somebody. And I said, I know you do, but we're going to put your feelings on a shelf. And we're going to talk about your thoughts. I mean, that was one of the big breakthroughs for me as a therapist, going, oh, how you feel makes no difference. So I began to really emphasize with people, I don't care not that I don't care, but I'm not going to talk to you about how you feel. I'm going to talk to you about how you think. So that's one of the first things that I lay the groundwork, and I say your feelings lie to you. And in my book, Mervous Tames OCD, I gave him, by the way, so many of the things, the combination, I mean, it's somewhat about my child, right? I photoshopped the school I went to growing up. I mean, there's some more
Okay.
personal things in there. It's a combination of so many things with different people, children, and patients I've worked with. I gave them to Mervous, right? He had to line up his clothes color coded, and he had to tape his cars in squares, and he couldn't throw his different colored cars in the air because that bothered him. And the people I've worked with, their anxiety has been in many of those areas. Like, I can't do it. And I said, of course, yes, you can do it. And we are going to do it. And we're going to make this bully small, and your brain is going to make you big. I know I'm covering a lot of territory here because I love to talk about OCD. Love it.
Well, I kind of wondered about the, when I read it, I was like, man, you gave, Mervis has a lot of different, not that OCD tends to throw out a lot of things, but it usually does like one or two, and you were
Yes.
giving him a lot of stuff. So I
Yep,
wondered about that.
yep. I gave him everything I could put into a kid's book.
Okay.
But I guess what I was trying to talk about in that book was primarily the picture of Bruno the bully, because I always lay the groundwork that OCD bullies you or you bully it. It's one or the other. It's not going to be a neutral ground. You're going to win or it's going to win. And I love the graphics in the book. I worked with the artist for a long time to say, get him big, make him terrifying. And he's going to overwhelm and follow Mervous everywhere he goes, because that's what happens, right?
Hmm.
And the best part of it, and I've just republished the book. The first book, as I think you saw, was a larger book. This is more like a chapter book. And I have a couple more pictures in the new book. But I love the pictures a little bit better in the new book, because they were able to demonstrate how, as Mervous pushed back and spoke to the bully, stop, you won't do this, I won't listen to you. He got smaller and smaller and smaller. You see, he still remained. If you notice in the end of the book, he's still extremely muscular, but he's tiny. And the fun thing about it was my grandson just read it this morning, because I've just had it published. And we were practicing our ukuleles here in my office, and where I do my therapy, and I have my new published book on the desk, and he read it. He sat and read it. He's 8. And he read it, and he says, oh, Grandma, look how small he gets. And I said, that's right. That's what we do with the bully, is we teach them that we are going to control them, even if they're in our lives. And that is sort of the ta-da in the book for me, is like, yep, they might never go away and they might be muscular, but you are going to be bigger than this. Anyway, that's kind of why I got off on the book. But it's a combination of so many patients that I've worked with, and very few people, as you said, have all of these things at once. It usually comes in some form, like there's a symmetry issue, or there's a germ issue, or there's a moral doubt issue, or there's a counting issue. But so you don't normally have them all. Poor Mervous, he couldn't even function. So, yeah, but he was able to push back on the bully. So that's where I start. And that's why I put in my book that as a primary emphasis, because that's what we do. We start with understanding conceptually how you're going to start dealing with this.
What got you to the point of wanting to write a book, or where did that, evolve from? I know you mentioned your son, your own son, but how did you decide to write a book?
Well, it's interesting. I was just, it just began to start to rise within me. It's hard to describe, but after so many years of working with it, I just began to feel the story form in me. And I thought, and I started putting some things on paper, and then I started reading them to a select kind of little reading group of people who would check it out. What do you think about this? It's very important, if you write a book, to have a group of people who will edit for you. I read them the basic story, and I said, do you think this is worth putting on paper? Some of them were writers, a psychiatrist. It was a group of people, just average people, and they said, oh, this is a great story. So then I began to shape it, and then I would take it back and forth to them. And originally I had Mervous climbing a tree, and he was playing in his neighborhood, and he was escaping. And anyway, I had to reshape it so that it was something that really everyone could deal with, and especially in the school setting, because that's a lot of places, I don't know, it just sort of burst inside of me. And so one weekend I sat down and I wrote the whole thing out. And from there, I took it to my reading group, and I thought, I'm excited because this is exactly how it is. And it came out of how I talk to people. I realized I kept talking to them about this bully in your brain. And I thought, that's a great graphic. It's a great picture. So if I could, I want to give one more story. I
Sure,
know I
sure.
love talking about it. So I had a little girl in my practice, and her name is Alex. And so I've dedicated my book to her. Alex was about 12. And that's all I'll say about her name in terms of identification. She came to me with some really pretty severe OCD. And this was a number of years ago. And as we talked and I learned more, she had a lot of things at one time, not just one. I'm not going to talk about her particulars, but what we did was we started talking about what we call the hot brain and the cool brain. And if I got that idea from the back of the book, Brain Lock, there's a PET scan picture. PET scan is a positron emission topography, and it shows what the brain looks like with OCD. It was a pre-treatment, post-treatment brain. And I said to her, Alex, what we need to do is turn your hot brain to a blue brain. I drew a picture of a little brain, tiny brain you could put in your pocket. And one side was blue and the other side was colored red. And I said, I want you to put this in your pocket. And when you start having those thoughts and carry it with you at school, I want you to turn it to the hot brain. And I want you to feel the hot brain in your hand. And I want you to say, I am going to turn my brain to a blue brain. And I want you to flip it over. And she would do that during school when intrusive thoughts would come to her. That's kind of how I got the idea of having Mervous go to a room. She couldn't really leave a room, but I had her do an action that sort of took her out of the repetitive thoughts and gave her an assertive response towards it. Okay. So we talked about the hot brain and the cool brain. And so that kind of why I dedicated it to Alex, because, she and I created these things, and the stop sign came from this as well. I also laminated a very small stop sign, and she put it in her other pocket. And I said, I want you to turn your brain to the cool brain, put your hand in your other pocket, and I want you to say, stop, stop. And the stop sign was like the best picture I could. So in my book, I have Mervous create a stop sign. I don't have him carry it around with him like she did, but I had him put it in his room because he seemed to be really bothered in his room when he played with his toys. He would look at the stop sign and he'd say, stop. So that was a great learning experience for me. And I just loved working with this girl, and we made a lot of progress using these visual aids.
That's a great story. Do you see that the book has it, I guess, what has it been able to do for you since you've published the book?
Well, initially, when I published the book, it was really awesome. I published it in 2012 originally. Since I'm a therapist at the medical center here in Lincoln, they really got behind it. The Lincoln Journal-Star came and did a piece, and the television station did a piece, and I did a presentation to 350 people in the community on OCD. As an extrovert, give me a chalkboard or a video presentation and 350 people, and I'm in heaven, right?
Yeah,
So that
yeah.
was like really, really fun. It gave me a lot of exposure as a therapist. What I really wanted to do was sell my book versus see more people, because I only have a part-time private practice, and more people wanted to see me. And it's like, I don't want to see more people. I want to sell more books. So that was kind of a little disappointing, the outcome, but I loved the experience. It was great. The problem is the marketing is very expensive. And this is I published this book privately. I paid to do it myself. It was not published by a company. I was published by Ex Libris, but it was the on-demand published. So bookstores have a hard time carrying it because it's on demand, print on demand. So that's been kind of disappointing. And because I was so excited about the book, I never actually went to publishers and presented it, because I really just wanted to publish it because I wanted to get it out there.
Mhm.
So that part has been harder because I haven't had much exposure. I wrote it for therapists, parents, and teachers to work with children with OCD. And really only 2% of the population has OCD. So it's not a huge kind of group of people, and even children less so, because they developmentally it gets a little worse at different periods in time. So you don't see many children with OCD. What it's done for me is I have it in my office and I use it as a graphic when I work with people. I can't say that it's launched and flown to the moon, but I still really believe in it, and I think it's a great book.
Well, hopefully, as my audience hears about it, that they will take attention to it. The word of mouth thing can be very powerful, and especially in social media nowadays. So hopefully that will work for you. I guess the last thing that I would ask, I always like to give the opportunity for my people I interview to tell the audience if they are interested in finding out more about you, like giving your website, how they would contact you if they wanted more information or to get the book or whatever. What information you would like to get the audience to know where to find you, I guess, is the best way.
Okay. Well, first of all, I just republished my book through TopLink, TOPLINK. And TopLink did a website. I had one through Ex Libris, which just expired. The domain just expired because I went through TopLink. It was a great website through Ex Libris, but I don't need two websites with the same thing. And I believe it's Mervous Tames OCD. I mean, if you type in Mervous Tames OCD on the internet, it comes up.
Okay.
I also, if I could, I'm just going to depart for just a minute. There's a
Sure.
really great video on YouTube that I've used often when I do presentations. It's called Chad with OCD, and it was like a A&D documentary. And I also have a YouTube video called Help My Child Has OCD, and it's on YouTube, and it explains so much about OCD. I would highly recommend it. I did it in 2012. It's very up to date in terms of information. So Help My Child Has OCD on YouTube. TopLink has my book. Amazon carries it, and there's a website through TopLink, and I believe it's Mervous Tames OCD, and I had to change it a little bit right this minute. It just really came out in the last month, so anything can be found under that book title. So that's basically what I can say.
And to let my audience know, I will have all the website information up there. I'm going to look for these videos too, and probably have them up on the website. But I on my both the invisiblewheelchair.com website and my family OCD, I put these resources of the people, whoever I interview, I always put their information up there. And
That's awesome.
So I will have that up there for them to find you and find out more about your wonderful book and you. You've been wonderful to speak with today, and I really thank you for taking the time this morning to sit down and chat with me.
Well, thank you. This was great, and I can hardly shut up when it comes to this topic because I enjoy it so much.
I definitely could feel the passion behind it, that's for sure. So this concludes this podcast. We really would appreciate your comments. Simply leave a comment at www.invisiblewheelchair.com. There, you're able to submit a comment that will help us determine future podcasts. If you or someone you know would like to be a guest on the podcast, please email don@invisiblewheelchair.com. Remember, there is a corresponding tapping recording for each of the podcasts, with the exception of the interview podcast. You can find these tapping recordings and archive past podcasts at www.invisiblewheelchair.com. Finally, there is relief for OCD, and we at FamilyOCD.com and FocusedHealthyFamily.com can help you find that relief. Again, you can contact us through those sites, FamilyOCD.com or FocusedHealthyFamily.com. You can also find us on Facebook at Invisible Wheelchair Podcast. You can find us on Twitter at InvisibleWheel1, that's the number 1, or at FamilyOCD. So thank you for listening. Keep tapping and transcending your life to new heights.